think we all understand that the COVID-19 pandemic has compounded the country's longstanding health disparities. The fact is, America really has two healthcare systems. In the suburbs, often affluent white families have all kinds of incredible healthcare. That's a stark difference to areas where many more Black or Latino families live. They really face, in many instances, healthcare deserts. For those communities, long drives, long wait times, or a lack of health providers are enormous constraints. This is especially true when it comes to mental health, where the United States has the worst record among similar countries. Here's a statistic to remember. Women today are more likely to die in childbirth than their mothers. Women of color have borne the brunt of this tragedy. Black, American, Indian, Alaskan Native women are 3 times more likely to die of pregnancy-related complications than their white counterparts. So our first question is, do you agree that extending Medicaid coverage from just 60 days to 12 months postpartum, as the House COVID-19 relief bill provides, is a necessary step to reverse this rising maternal mortality crisis?
Mr. Chairman, absolutely. And if my wife were allowed to say a few words, she'd probably say, keep going, don't stop.
Good. If you're confirmed, Mr. Attorney General, what else would you do right out of the gate to address the significant racial, ethnic, and geographic disparities in maternal health?
Mr. Chairman, I've worked on this for many years. We need better data. We have to be collecting information that lets us know where to go. If we collect bad data, we're going to have bad results. So one of the first things we have to do is make sure that we're collecting good data, and that's a responsibility that HHS has in many respects. We also have to reach out to the communities that know the people that we're missing. Go to the civic and religious leaders back home where we know we're missing families. They are respected, they are trusted, they can help us reach out to those folks. We have to train a better workforce, a bigger workforce, and we have to make sure they're competent in the cultural and linguistic differences that oftentimes we see. And of course, we have to tackle the social determinants of health that I think, I'm proud to say now, as I watch what Congress is doing, it's great to see how much it's a bipartisan effort now.
Mr. Attorney General, let's return to the issue of mental health for a moment. And I think it would be fair to say, from sea to shining sea, communities are reporting that mental health demands for services have just soared into the stratosphere. And it is for virtually every group, for seniors, even schools. You know, youngsters who have had challenges learning are reporting being in need of mental health services. And I want to say, I think this mental health challenge right now is the public health equivalent of a 4-alarm fire. It is just that serious, with the situation of care being too expensive or unavailable. And it's something I take very personally because my brother was a schizophrenic, and for years there were nights in our household where he would be out on the streets and we were convinced he was going to hurt himself or someone else. So the question then is, what do we do about it? And one of the solutions comes from my home state, and it deals with some of the challenges that we're facing on the streets. I've talked to several of my colleagues here, and Senator Crapo and I have had discussions about it. On the streets, very often the question is, do you look to a mental health counselor or do you look to law enforcement to try to respond in the appropriate way? And we've come up with a program in my home state called CAHOOTS, which is supported by both mental health counselors and law enforcement people. Senator Cortez Masto is our lead sponsor. A number of other colleagues are for it as well. And our approach deploys Medicaid, which would be under your jurisdiction, to set up mobile crisis response teams that can be dispatched when a person is experiencing a mental health or substance use disorder that would be appropriately handled from the mental health side rather than the law enforcement side. So my question is, and time is short and I apologize for that, if you're confirmed, would you be supportive of efforts like the CAHOOTS program so we can expand it in my home state of Oregon, but also implement it across the land?
Senator, count me in. I know law enforcement back home would say the same thing. It's not a good use of our resources as we watch, as the 911 call comes in, and we're now seeing a person who's in distress, usually mental distress, on the streets. It's our officers who are asked to respond, as they will tell you. They're not trained professionals on mental health care, social services. They're trained to do public safety protection. And they would love to have people working with them so we can make sure the right professional is the first responder to these cases.
Okay. Very good.